Here's the basic structure and function of hemoglobin. So there's 4 subunits, 2 alpha subunits, that's what's in pink here, 2 beta subunits, which are in purple, and then each subunit has a heme iron. So hemoglobin contains iron. We need iron to form hemoglobin. And that's why one of the most common causes of anemia is iron deficiency anemia. So that could be from something like a vegetarian or more so a vegan diet, so low intake, increased need. So we'd see that in pregnancy. It's very common. Or slow bleeding. If you're losing iron over time, that can be from a slow bleed, like so heavy periods. It can be from during a menstrual cycle. It can be from a slow GI bleed, like an ulcer that's slowly bleeding, or even donating blood too often. Because when you donate blood, you're depleting your iron stores over time. As long as they can rebuild, you're fine. But if you over donated or donated more than you should, that could also deplete your iron stores. So that's one cause of anemia. So what this hemoglobin does, it binds to oxygen. So 1, 2, 3, 4 molecules of oxygen it can bind, and then it goes to the tissues. The conditions where it's more likely to drop off its oxygen to tissues would be there's low oxygen content in the tissues, high carbon dioxide, and a lower pH, so it's more acidic. So that's going to promote hemoglobin to dissociate with oxygen and give it up. And that's the function of hemoglobin. So O2 saturation, that's the measurement of how much oxygen is actually bound to hemoglobin. And you can get that in arterial blood gas, an ABG, or in little finger thing, the SpO2, that's pulse oximetry. So an ABG would be an SaO2. With the pulse oximetry, it's an SpO2. And whatever is not attached to hemoglobin is dissolved in the plasma. Textbook numbers would say 98% bound in hemoglobin, 2% dissolved in plasma. We know clinically, obviously, there's normal ranges. Okay, so that's the function, hemoglobin. So other than iron deficiency anemia, another anemia we could talk about are anemias called hemoglobinopathies. The one we talk about the most is thalassemia. So alpha thalassemia, there's a genetic mutation of the alpha subunits. Beta thalassemia, there's a mutation of the beta subunits. And when that's the case, hemoglobin can't bind enough oxygen, hence causing an anemia.